Hi, my name is Dr. Sarah Wakeman. I'm the Medical Director of the Mass General Hospital Substance Use Disorder Initiative and an Assistant Professor of Medicine at Harvard Medical School. I recently wrote a piece about a patient I lost to opioid overdose. Like my patient, 5 to 6 people will die just across the state of Massachusetts today. One of the many tragedies of these deaths are that they are entirely preventable. They stem from a treatable condition, opioid addiction, and the overdose event itself is entirely reversible with the medication naloxone. And yet all too often, people who continue to struggle with ongoing opioid use disorder use in secrecy and use in places where they don't have access to medical care in these moments of crisis. My own journey, as I read the literature and came to understand what's been shown to be effective for people who continue to use drugs, is that supervised injection facilities, which are medically monitored spaces where people who are actively using drugs can go and use in a safe setting, and in the event of an overdose, there are staff on site that can immediately respond and save a life. What I learned is that these facilities not only save someone's life in the short term from overdose, but they also increase the likelihood that someone will go to treatment. They do not increase drug use, and they actually improve public safety in the surrounding neighborhoods around these facilities. We've often talked about not wanting to enable drug use, that if we're too kind to people who are using drugs, they might do so at a greater frequency. If we've learned anything from the current crisis, it's that that outdated way of thinking is not accurate. I encourage you all to begin to think about how can we enable health? How can we enable people to stay alive long enough to engage in treatment and ultimately, hopefully, to enter into a pathway of recovery and wellness? Thank you.